Hello, my name is Dr. Dewan S. Raja. Today I will discuss about Cauda Equina syndrome. The Cauda Equina syndrome is caused by the dysfunction of multiple lumbar and sacral nerve roots. What is Cauda Equina? Cauda Equina is the collection of dorsal and ventral spinal nerve roots from lumbar 2 to coccyx 1, from the conus medullaris, that is the lower end of the spinal cord, to the coccyx inside the vertebral canal. Cauda equina means that the tail of a horse. The nerve roots in a collection, they look like the horse tail, so it is called Cauda equina. These nerve roots descends through the subarachnoid space to exit through their respective intervertebral and sacral foramina. These nerves provide motor and sensory innervation to the pelvic organs, perineum, and lower limbs. Okay, so one of the important cause of this Cauda equina syndrome is intervertebral disc protrusion. Okay, like that. It compresses this collection of nerve fiber. This is the conus medullaris of the spinal cord. From here we have collection of nerve fiber up to the coccyx. We call it Cauda equina. So this may be compressed by the herniated disc, herniated intervertebral disc. There is the nucleus pulposus. This is nucleus pulposus. This is annulus fibrosus. Nucleus pulposus herniate posterolaterally. Okay, it may compress these nerve roots. These nerve roots are the Cauda equina. They form the Cauda equina. So vertebral canal containing cerebrospinal fluid and Cauda equina here, and we found that intervertebral disc protrusion in the lower lumbar region is a very common condition. And this is Cauda equina, and this is the coccyx 1. It begins from at the level of the lower border of lumbar vertebra 1 from the conus medullaris, and this is the collection of nerve fibers. This is called Cauda equina. So any lesion, any tumor, any injury, any hemorrhage in the vertebral canal compromising or dysfunctioning the nerve roots will lead to Cauda equina syndrome. Okay, so if we look at that picture, Cauda equina syndrome cause both motor and sensory problem. Here we are seeing some sensory lesions like that of here, low back pain. This is saddle pain. Okay, so this is saddle pain. Okay, this we can say it saddle pain, saddle pain area. Okay, okay, we got that. So this pain is not only confined here. It may go from this side, from here it go to the back here, entire back of the leg. Okay, not only back of the leg, also the entire limb, anteriorly, posteriorly. Okay, so we may have pain, and that pain may be symmetric, both sides, may be asymmetric. Okay, it may be possible. And not only the sensory innervation is lost, we have also motor innervation of the nerve, so that knee jerk will be diminished, ankle jerk will be diminished, person will unable to dorsiflex the foot because of nerve weakness. Suppose knee jerk will be diminished because lumbar 2, lumbar 3, lumbar 4 nerve roots are compromised, may be compromised. Here iliopsoas muscle may be weak, so that may be a possibility. And the area here, sensory innervation may be lost. So ankle jerk may be lost because of S1 lesion. Okay, that may be possible. So depending on the situation, okay, we go there. Then if we go to the Cauda Equina syndrome, causes of Cauda Equina syndrome, spinal tumor. It may be primary tumor, it may be secondary tumor. In many cases, it is secondary tumor to the vertebral column. Okay, maybe the local tumor like meningioma, that is also possible. Okay, spinal injuries and inflammation, maybe trauma, maybe a complication of road traffic accident or inflammation. The meninges around the spinal cord and the cauda equina may be inflamed. Intervertebral disc herniation, there is a very common cause. Okay, it is usually posterolateral, therefore the motor and sensory loss will be asymmetrical in many cases. Hemorrhage, maybe epidural hemorrhage, subdural hemorrhage, subarachnoid hemorrhage, any type of bleeding within the meninges or just outside the meninges will lead to Cauda equina syndrome if it is inside the vertebral canal from the lower lumbar 1 vertebra to the coccygeal region. Any hemorrhage inside the vertebral canal will lead to Cauda equina syndrome. Complication of, we'll add one word of, okay, complication of, okay, complication of spinal surgery or spinal anesthesia. We have some red flag symptoms. Red flag symptoms, this is an emergency situation. This part should be tackled by the licensed physician, specifically neurosurgeon or orthopedic neurosurgeons. Okay, what are the red flag symptoms? Urinary retention, very common. Okay, urinary retention is very common, specifically the parasympathetic innervation. Urinary incontinence, again, that is again S2, S3, S4, dysfunction, sexual dysfunction. Okay, there may be impotence, male impotence, or there may be problem in ejaculation. Fecal incontinence, because of the anal sphincter may not work properly. Settle anesthesia, we've seen anesthesia around the sacrum, around the perineum. It may be unilateral, it may be bilateral. Asymmetric weakness and paralysis of the lower limb, usually asymmetric. If it is a central herniation, that is unlikely, but it may, in that condition, it may be symmetrical. Asymmetric pain in the back and leg is also possible. Okay, not only pain, weakness, the person cannot dorsiflex, person cannot flex the knee, person cannot flex the hip. That is also possible because of paralysis of iliopsoas muscle, paralysis of quadriceps muscle, paralysis of the dorsal extensor muscles of the foot and the leg. Okay, so that may cause a lot of motor and sensory disturbances. Okay, we got that. So how can we diagnose Cauda equina syndrome? His diagnosis by history and physical examination. This is very important. MRI specifically to localize the lesion of the nerve. CT scan any bone changes, that will give a better idea. Okay, myelogram, anything wrong, any compression to the lower part of the spinal cord. Okay, so that may be especially in the conus medullary area, so we can go to the myelogram. So this is very important. History, physical examination, MRI, CT scan. Treatment, this is a medical emergency. It should be treated in the hospital by the neurosurgeon, orthopedic neurosurgeon. treatment according to the cause. If it is due to a tumor should be removed. If that is due to infection should be controlled. If it is due to inflammation, then the patient should get anti-inflammatory drug. Need immediate medical attention from neurosurgeon and orthopedic surgeon. Okay. And that's all about Cauda Equina syndrome. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel and please subscribe me. Have a nice day. Bye now.